Thank you very much, Emil, for that introduction. I will be talking a little bit about the application of philosophy and how it's relevant in medicine. So the application of philosophy and specifically moral philosophy in medicine is somewhat unavoidable because medicine by heart is a moral enterprise. And now medicine is a field in which there is an inherent trust relationship, right, between the physician and the patient. And so suppose you as a patient go into your doctor's office and the doctor might ask you, what can I help you with, right? And at this point, you as a patient should have some expectations. Well, what are these expectations? For one, you would ordinarily think that this person has an understanding and like a knowledge that you need. And secondly, you would hope that the doctor would use this in your interest, right? And not in her own interest or in the interest of the insurance company or the hospital, for example. And this is because you as a patient you're in a vulnerable position, right? So vulnerable, in fact, that you can be taken advantage of. You may be anxious and stressed out. You're probably in some kind of pain or distress, and you're putting yourself in the power of another human being. So this is virtually by definition a trusting relationship, and that's what makes this a moral enterprise, right? Because moral philosophy or ethics deals with the rights and wrongs of human acts. Now there are a whole host of different subjects and sort of discussions that we could have at the intersection of philosophy and medicine. And in this talk, I will briefly try to highlight 3 such intersections. Okay. So let's start with the first intersection, which is the debate and discussion concerning abortion, or the issues around abortion. Now, abortion and the debate around abortion is highly loaded, and for some people it's very emotional and can sometimes be a very explosive type of debate. And it's the sort of debate that seems to seep into every level of human exchange and interaction. Well, we talk about it in the family, and friends might have discussions about it, and politicians in some countries run their whole campaigns on it, and the laws are enforced on the basis of it. And it's also highly relevant in many academic fields such as biology and medicine, philosophy. And it's a topic that had been debated on for several decades now, and as such there is a rich academic and philosophic basis for it. Now, I would argue that it's really impossible to truly understand this debate if you're not familiar with philosophy and the arguments that the field of philosophy has produced in the abortion debate. Now, for the sake of time, I'm not going to go into the arguments in this presentation, but they are very well developed and highly sophisticated. And for people that are interested, I would suggest looking them up. But I don't think they're really relevant for this particular talk, because I'm going to try to sort of bridge the gap between philosophy and medicine. So what I am going to do is I'm going to present 2 stories, right, that sort of illustrate the relevance of this to medicine. Now, these 2 stories are very similar. They are, in fact, identical, except one key difference, which I will show you. Now, imagine you're a doctor, right, and a patient comes in. She's pregnant, and according to the chart that you have in front of you, she's 13 weeks pregnant. And she comes in and tells you that she wants to have an abortion. You ask her, why do you want to have an abortion? And she goes on and tells you her story. Now, before I tell you her story, suppose that you're a doctor in like this parallel office, right? And again, a woman comes in She's 13 weeks pregnant, and she says she wants an abortion. You ask her, why do you want an abortion? And she tells you her story. Now let's start with the first story. And so far, these two stories are identical. So it's exactly the same thing. Okay, so the first story, the woman tells you that 13 weeks ago, she was raped and assaulted by a friend of the family, and she felt too ashamed to tell anyone, and so she kept it to herself. And now she feels depressed, and she feels like she can't go on with this pregnancy, and she sort of like resents carrying this pregnancy to term because of the horrific conditions, and that's why she wants to have an abortion, right? That's her story. Okay, so the second story, the woman comes in and she says that her husband just bought her tickets to go to a concert, which it's going to be in about 10 weeks' time. And she knows that it's going to be drinking going on at this concert, and she wants to wear her finest outfit, and she don't want to feel fat and pregnant, and she wants to like fully enjoy this concert, and that's why she wants to have an abortion. And that's her story. Now, people might have different views as to what should be allowed in these two cases, right? So in both cases, the woman is 13 weeks pregnant. Both have sought medical help. Both have put their trust in the hands of their doctor. And the help that they want specifically in these cases is help with the procedure of an abortion, which is the removal of something that is unwanted, right? So some might think that abortion should be wrong in both these cases. And some might think that it should be allowed in both cases. And some might think that it should be only allowed in the first story and not allowed in the second story. But why? So the question is, why do these stories feel different? After all, they wouldn't really be different if the woman came in and said, I want to remove a mole or a cyst or an outgrowth of some kind, right? So the reason why an apparent issue arises here is because we recognize that the thing that is being removed at some level should be worthy of our consideration. And at what that level is really difficult to purely justify on a scientific basis. And if you look at the arguments for both for and against abortion, you realize that a pure scientific justification for this is almost impossible. So that's where philosophy comes in. And as I explained at the beginning, it's really impossible to truly grasp the arguments and the debate if you're not familiar with the philosophical arguments concerning abortion. Okay, so the second intersection that I will talk about is gender, which is one of the most influential sort of like ideas in the 20th century, which was the emergence of this philosophical idea of the distinction of sex and gender. Now, in order to explain and sort of like set the stage for this debate, I think it's helpful to provide some background knowledge on the origins of the debate and what the key concerns are. So at the turn of the 20th century, there was this emergence of feminist philosophy, and they started to discuss this philosophical idea of the subjugation of women and in the workplace and in different societal levels, and the issues of inequality and a sort of like attack on biologic determinism. And this eventually led to an emergence of this idea of distinguishing sex and gender. Okay, so historically, this distinction began in around the 1950s with John Money and his colleagues, and they used the term sex to refer to an individual's physical characteristics, and they used the term gender to refer to an individual's psychological characteristics and behaviors. Now the traditional view, or let's say the old view of the terms man and women, said that man is an adult human male and a woman is an adult human female. Okay, this basically means that a man and a woman are biological terms in the same way that a male and female is. The revisionary view, or let's say the new view of the terms man and woman, would claim that these sort of like old views should be revised to be defined in another way. They would say that man and woman should not be defined based on biological terms at all. Rather, they should be defined to something sort of like social position maybe, or a particular set of experiences, or self-identification, or something like that. Now, there are several candidates for what these definitions might be, and many feminist philosophers have offered different definitions. And one of the most widely accepted definitions is something along the lines of, to be a woman is to repeatedly perform as a woman. This is sometimes called a performance view, or to like behave in line with feminine gender norms, right? And to be a man is to behave or perform in line with masculine gender norms. But in any case, this sort of debate and the idea among feminist philosophers is what we today refer to as the gender debate. Yeah, and the beginning of the gender debate. Okay, and so what they did is that they revised the terms man and woman to denote gender. So man and woman would be gender terms, and male and female was used to or allocated to denote biological sex distinctions, or at least that's what these philosophers claim. And the reason why they wanted to make this distinction is because they maintain that distinguishing sex from gender is an important step in recognizing that biology is not destiny, right? So they wanted to make this difference to sort of like explain that that many of the differences that are apparent between women and men might be imposed by society rather than occurring naturally. So whatever you're born with regards to your sex, you can achieve anything and you can become anything, and biology doesn't stop you from achieving. Now, I'm not saying that this debate on the distinction of sex and gender is a settled debate, and I'm also not saying that I agree or disagree. I'm just laying out the historical facts of the origins of the debate. So the next question is, how does this philosophical movement influence medicine, right? And how does it influence public health and individual well-being, which is the subject of this talk. So I would say that this new way of thinking and defining sex and gender has contributed to creating a shift, right, in the way we approach certain illnesses in the medical field. And this shift has led to research being conducted, especially in the field of psychology and psychiatry, where we often focus on social factors that drive human behavior rather than internal causes, right? So we don't focus on the biological causes as much as we focus on the social causes. And this is a natural thing to do, because if it is the case that behaviors are explicitly a result of society or environmental or cultural norms, then it's logical to say that some of the behaviors that we think of as psychological conditions might have their etiology in nurture and not in nature. And one example of this would be autism spectrum disorders. Okay, so in the US, 1 in every 40 approximately males is diagnosed with autism spectrum disorder, and 1 in maybe 200 women are diagnosed. So this is between a 4 and a 5 point differential, right, between males and females diagnosed with this. And this is a behavioral disorder. Now, to what extent is the contribution of nature, and to what extent is the contribution of nurture to this disease? It might turn out to be purely nature, and it might turn out to be purely nurture, or it might be a mix. We really don't know the answer at this point, but the fact that research is being done, and pretty extensively so in this field, shows that there is a clear shift, and how how powerful the contribution of philosophy really is to medicine, right? Philosophy has sort of shifted the public feel. Now, you don't have to think it's right, but the fact that it has shifted the public feel and sort of the atmosphere to such an extent that research is being done on a pretty large scale, it just shows how effective this movement has been, right? And there are other topics as well. It's not just autism spectrum disorder. We have, for example, the prevalence of body dysmorphia and eating disorders. We have a higher prevalence among females. ADHD, we have a higher prevalence in males. These are also behavioral disorders, and research is being conducted in these areas as well. Now, for those that are listening and maybe are a little bit skeptical in changing the traditional view of sex and gender, I'm gonna provide an example as to why at least I think this sort of research that is being done is important, right? Even if you believe there is no difference between sex and gender, I think that the research that is being done is important. So one example would be in the area of childhood toy preferences. Okay, so popular narrative would say that the gender difference we see in childhood toy playing is entirely determined by social expectations, right? This is a social thing. It's culturally based, and that's what the popular narrative would say. That is what we thought was the case. Now, this belief has led to several large-scale research studies, and new research done on this topic show that children's toy preferences are that there actually is sex differences in boys and girls toy preferences, right? And this difference we see across different ages and time periods and cultures and countries. And the study found that children overwhelmingly choose to play with toys that are gender specific. So boys play with male typical toys and girls play with female typical toys. And these findings were contrary to the popular belief that childhood toy playing is a result of society and sort of like environment, right? And so you might ask, what's the relevance of this to medical health? Well, in this research, one of the researchers in the study was purely interested in the research from a medical standpoint. So his interest in this research was from his background in study of polycystic ovary syndrome, PCOS, which is a condition where women have slightly elevated testosterone. Now, we don't know the cause of PCOS, right? But animal research suggests that the female fetus in a PCOS pregnancy is exposed to high levels of testosterone. And this programs her for later development of PCOS. Now, if elevated testosterone actually is the cause, we don't know that it is, but it's a theory, but let's say that it is the cause, then one of the effects we might see in childhood is an increase of interest of girls in male typical toys, right? So therefore, if we do see a greater interest in male typical toys in PCOS girls, then this is potentially an important finding, and it can help us understand the etiology and the cause of this disorder, and therefore potentially a cure for PCOS. Okay, so the last intersection that I will talk about is human enhancement. Okay, now this topic is a topic that had come in favor in recent times, and it's a topic that will become increasingly relevant in the future. And human enhancement have several definitions in the literature, and I put up one definition on screen right now. And I would say that to correctly distinguish what we're talking about when we're talking about human enhancement, I would say that there's a difference between genetic modification and genetic enhancement. Okay, so what's the difference? Modification is related to disease prevention and treatment. Okay, so we change the genetic code of an embryo, let's say, that has a genetic point mutation, and we treat an illness. Okay, or we can change it in the somatic cell of an adult and treat an illness in that way. Okay. Human enhancement, on the other hand, is not about preventing or treating disease. This is related to augmentation. Okay. For example, you change the height of a person, or you change the intelligence, you make them more intelligent, or you change the bone structure, or some other physical appearance, right? Or maybe change the intellectual capabilities of a person. Okay. Now I would say, like, it's easier to conceptualize this if we think about human well-being to be on a spectrum. Okay, so think of human well-being on a spectrum, and on the far left of this spectrum, you would have illness. Okay, clear manifest illness, disease, and a sort of like low level of human well-being. Okay, I would say think of people that are born with genetically critical conditions. Okay, or like illnesses where a person has a lot of pain, maybe, or just a general low level of well-being. On the other end of the spectrum, on the far right end of the spectrum, you have no illness at all, right? So you have, let's say, eternal life and a sort of like idealistic view of well-being, or an idealistic idea of well-being. And in this case, I would say, think of certain capacities that we find in comic book superheroes, right? Things that don't naturally exist in humans and that will never exist as a consequence of pure natural evolution. They can only exist, even only potentially exist, as part of genetic manipulation. Okay. And then in the middle of this spectrum, we have a level of well-being that is not really manifest illness or sort of like something that we would treat as physician. Especially like if we think about this, the left side of this middle part, I would say think of people that maybe are missing a finger or having a mole. I mean, having a mole is actually pathological, right? It's a pathologic condition, but we don't necessarily treat it, right? We don't treat every person that has a mole. Okay. And on the right end of this middle part, we have conditions that are consistent with natural evolution. So here we have a picture of Captain America, but I would say, like, think of a person that are maybe, I don't know, like born with 150 IQ or 200 IQ, for example, or maybe is like incredibly strong or has a very good like immune system, never gets sick, something like that. This is not incompatible with natural evolution, but of course, genetic manipulation will get us there more efficiently and more quickly. Now, on this whole spectrum of human well-being, so if you look at the whole spectrum of human well-being, you can have genetic modification, right? And then you can have genetic enhancement. Okay, so any genetic manipulation that is done for therapeutic purposes, that's what we call genetic modification. And any manipulation that is done to enhance a certain characteristic, we call it genetic enhancement or human enhancement on this definition. Now, this might seem like some future idea thing that's far in the future and it's not really relevant, but it's not actually that far in the future as it might seem. I mean, there are several scientific advances in recent times. For example, the CRISPR technology, which prompted widespread discussion and in the scientific fields, and it's basically like a gene editing method that makes the editing process a lot faster and more efficient. And although this type of technology in the beginning certainly will be used for therapeutic purposes, it's sort of like inevitable that as this technology grows and it becomes more and more efficient and cheap and widely available, it will be inevitable that this technology will be grounds for potentially using it for human enhancement. And so this is a field where philosophy has to do a lot of work in formulating arguments both for and against the idea of human enhancement, as was the case with abortion, right? So as of yet, we don't really have a rich pool of arguments when it comes to genetic enhancement, but this will increase as time goes on. Now, to see how human enhancement plays a role in medicine, I will again provide two stories, okay? So imagine you're working as a doctor in your office, okay? And a woman comes in. She's pregnant. She's 5 weeks pregnant, so you can't tell just by looking at her. And this isn't just any doctor's office, okay? This is a future office, okay? Let's say the year is 2200, okay? And instead of using an ultrasound to view and assess the condition of the baby, you have this computer that has like a probe that can sequence the DNA of the baby in, let's say, 15 minutes, and in 15 minutes you sequence the entire DNA, and you know all the diseases of the baby, okay? And so let's say the computer found a problem, okay? You tell the mom, okay, the computer sequenced the DNA, and we found the problem. And the problem is that there's a genetic mutation, and it prevents the baby from developing eyes, okay? So your baby will be born without eyes, okay? But you tell the mom, so don't worry, we have the tools now to fix this. It's a simple genetic modification is all that is needed. And I will now go ahead and do the genetic modification, and I'm gonna make your baby better. I will make her better, okay? Now, should you do this as a physician? Should you go ahead and perform the genetic modification? Is there an ethical dilemma here? Okay, now consider a second story, okay? Again, you're working as a doctor. Again, this is a future doctor. Let's say the year is 2500, okay? And a pregnant woman comes in. She's 5 weeks pregnant, and she come for a consultation, and you go ahead and you sequence the baby DNA, and there is no problem, okay? So let's say this is a healthy baby girl, okay? The computer found no problem, and you tell the mom, okay, so I sequenced the DNA, no problem here, but now I will go ahead and I will genetically modify your baby's gene, and I will make her better, okay? I will make her stronger, I will make her smarter, I will give her a better immune system, and I will make her live longer, and I will give her a higher degree of emotional intelligence maybe, and enhance her senses, okay? Now, should you as a physician do this genetic enhancement? Is there an ethical dilemma in this case? Now, in both of these cases, you're moving the baby from one place of the well-being chart to another place. All right. So if we think about human well-being on a spectrum, as I said, in both of the cases, you're moving them presumably somewhere on the left to the right. So you're moving them from a lower place on the left side of the chart to a higher place on the right side. But somehow one of them feels a little bit different than the other, doesn't it? So there's a different feel. I mean, some people might say that you should do it in both cases, that you're just moving them from one place to the other. Both of them are right. You should just go ahead and do it. But some people do recognize that there is a difference in these two cases, that they feel a little bit different. And this is where philosophy has to do work to sort of like cash out the arguments for why they might feel different. So in summary, I would just say that like the aim of this talk was to highlight some of these areas where there is a distinct link between philosophy and medicine, and to show how philosophy can and has done in the past and will in the future have a significant impact on like public health and medicine and sort of the way that we view patient care.